some real science that indicates that when physicians come together at the level of the community and engage in systems level approaches to healthcare, that they can produce some pretty outstanding results.
My background is a son of a physician, and my father instilled a certain set of values around practicing medicine, and part of that was a very intimate relationship with the patients in the practice and the people working within the practice. At the core, my practice has remained simply a relationship with the patient. That has not changed over the years. What has changed is the consolidation that has occurred, but not just within the health delivery systems, but the consolidation of the payer and the provider systems coming together to become one entity. How we as an independent practice navigates that can be challenging, and the CIN, through the Pennsylvania Medical Society and the collaboratives, is a vehicle for us to kind of remain relevant and important and engaged through that consolidation. The Medical Society brings a huge amount of value to the process of trying to remain independent while still integrating care continuum throughout a community or a patient's care. So partnering with the Medical Society was a huge component for us in our deliberations about where to best align ourselves with our patients and the medical community. The Medical Society brings huge resources, they bring a huge amount of expertise, and quite frankly, a lot of legitimacy to the process.
The things I like about being an independent family physician is that we get a lot of flexibility. We can focus more on patient care rather than worrying about bureaucracies and things that sometimes goes along with working for the hospital. And it's exciting because we can actually also partner with community members and things, and we have that full freedom to do things our own way and what's best for our patients.
We joined the PA Clinical Network mainly because it was led by a number of other independent physicians looking to do what we do, preserve independent practices in the state, show the insurance companies that the quality of care we give is every bit as good, if not better, than a lot of the employed physician groups throughout the state. We can be very good yet profitable family practice groups, and this is important to us to attract new residents and new providers. One of the other advantages of being an independent practice is being able to serve your community without having to get involved in the wars between the insurance companies. If we remain independent and have, contracts with a number of these groups and prove to them that the quality of care that we give is every bit as good as their employed groups, so we can kind of continue the quality of care to our community without having to worry that half our patients may need to leave and go elsewhere.
We've been very, very well received. In a matter of a year, we were already at 1,000 patients, and we're well over that now. And patients are thrilled that they're getting a personal touch in a non-institutional environment, that we are not trapped into referring to, certain system of care. Medicine's become big business, and that's got pros and cons, but I think I see more of the negatives of that, in that physicians, along with patients, are becoming commodities.
I think that what we can offer is certainly way more personal than what a lot of the institutions offer. We get to know our patients, we know if they've been on vacation, their grandkids, and I really like that we offer that personal touch that a lot of offices, you're not just a number here, you're a name, and we know about you and we care about you.
I'm not bound by the boundaries of the employer who says your patient got to go here, and I can get the best care for the patient. I'm able to structure my practice that in a way that will benefit me and my work environment and the patient. For example, if I want to have hybrid chart EMR practice where I can spend my time looking the patient in the eye as opposed to staring at the computer screen for 90% of the time, I can do that. And then I can have staff maybe enter the information from the chart into the EMR and still have the best of both worlds. At the same time, I'm not at the bottom of the flow chart. And, you know, a lot of organization physicians are only a step above the clerks, and they're par with everybody else except the administration. So that, to me, undervalues a physician.
The choice to become an independent physician was a difficult one, mostly because many of the training programs that are out there, including the one I had, was formed and created by an organization. But as you get further out of, or closer to the end of training, and you start to experience what practicing physicians do in your area, when I had that opportunity to do that and do some shadowing and working in some independent practices, it became clear to me that my thinking and the way I approach medicine was more succinct with an independent thinking physician and not necessarily an employed physician.
We decided to join the PA Clinical Network for many reasons. One is because staying independent is really important to us, and we realize that it's us against a lot of big machines, hospital systems, insurance companies, and we really needed to join force with other independent practices in order to make that be sustainable.
We joined the Pennsylvania Clinical Network. I have been a strong advocate for it. We looked at many different other possibilities, and there's many fine groups out there. But I really felt that if the PA Medical Society doesn't have the patient and physician's best interests at heart, then frankly, there's not a lot of hope out there. Even with our own patients, some of these networks, even though we're not excluded, we're on second or third tier, so it costs our patients more to come see us, which frankly I think is a shame. One of the aspects of independence is I really develop a relationship with the staff. We really are family. We take an active interest. We decide, for instance, if there's someone's birthday that we're going to celebrate and we're going to take an afternoon off, that we do that. And unfortunately, we did have a long-term employee die, so we closed the office for the day and attended her funeral. But the point is, those are things that we can do that you can't always do in a larger system. The VA Clinical Network will be beneficial for all of us. My experience with them has been that they are a couple steps ahead of everybody else, and that's why we've been so active and excited about joining this organization.